What is the difference between a case study and case series? Case study is an in-depth studying of a case or multiple cases. Yes, you can have a case study with 2 cases, 3 cases, 4 cases. So they are known as multiple case studies. Although there is no specific number, remember this, there is no specific number involved. It can be 2 patients or 2 people, 3, 4 or more, but usually people keep 4. So for a case study or case report, if you're working with patients, then it will be called as case report once it's written. So remember, a limit of 4. I'm giving you a limit of 4. There is no universal rule, but just for understanding, and I suggest my students follow a 4 rule, a rule of 4, that 4 cases and it's a case study. More than 4, it's a case series. 4 cases, it's a case study. More than 4, it's a case series. And that's just my rule for my students. Although in reality, you will see that there can be more than 4 cases in multiple case studies, and there can be unlimited amount of numbers for case series. But for case series, we will keep a number from 4 plus to 50. Although there are case studies with 1,000 patients, 4,000 patients, yes. So it is possible. So for understanding right now, just keep a 4 and 4 plus. 4 is case studies, 4 plus is case series. This topic is clear, right? Now, case series is only for patients. That's why it is known as clinical series. Case study can be in any field in the world. It can have animals, yes. It can have patients, it can have people, it can have celebrities, it can be a thing. It can be anything in the world. It can be a location, a city, a country, a town. So case study can be in any field, but if it's patient involved, then you also call it case study, but when it's written, it's called as case report. And clinical series or case series is the same thing, and they usually are the patients. So now, in case studies, you are studying an in-depth understanding of a case or multiple cases. But here, in case series, you have only one group with similar features, similar symptoms, similar diagnosis, similar treatment, similar outcome. You have similar kinds of patients, so you have just one group. You are looking at them, you are studying them, okay? But in case study, you are looking at in-depth understanding or in-depth study. That means you will need multiple sources of data. Yes, in case study, you will need multiple sources of data. In case series, you don't need multiple sources of data. You can only rely on whatever data you already have from the lab findings or from the previous study, from the history, or from whatever the patient gave you the information about themselves. So now remember, again, I'll repeat again. Case series keeps case series on this side. Case series and case study. So case study can be up to 4 patients, sometimes more of as well, but for my students, just 4. Single case study only have 1 case. Multiple case, double case study will have 2 cases, then triple case study, then quadruple case studies. So these are the cases. You will have in-depth findings, in-depth understanding with multiple sources of data. In case series, you do not have multiple sources of data. You have similar cases, similar patients with similar features, similar symptoms, diagnosis, and similar outcomes. Only one group. Only one group. So that is the difference in case series and case study. I will come back again for further details about case study and case series. See you in the next video.